Everyone. Welcome to Ardent Sector Development webinar. My name's Jack. My pronouns are he, they, and thank you so much, everyone, for joining us today for this practical session on developing and delivering affirming and culturally safer alcohol and other drug services for the LGBTIQ plus sister girl brother boy community. And before we begin, I would also just like to acknowledge the traditional custodians of the land we're meeting on today. For me personally, I'm joining from the lands of the Turrbal and Yagara people. Pay my respects to ancestors, elders, and leaders of the future who lived their life spiritually and in relationship with country and all the living systems. I also want to acknowledge any Aboriginal and or Torres Strait Islander people who are joining us here for the webinar today. And I acknowledge that the enduring connection that Aboriginal and Torres Strait Islander people have to this land, to culture, to community, and to country. The colonial legacy of social control through legislations has been cemented by many countries across the world. Acknowledging and recognising the reverberations that the colonial past has on present context of discrimination and human rights violations experienced by LGBTIQ plus sister girl brother boy people is a step in tackling the legacy of colonialism. LGBTIQ people have been present for as long as we've been on this planet, and our existence has been traced throughout history. Indigenous countries across the world have recognised and often celebrated diverse genders, sexualities, and bodies that do not conform to the colonial understandings. So, by forcing people to subscribe to a strict colonial binary, we are furthering the effects of colonisation on this continent. Just a bit about me. I'm a proud transgender and gay man. I'm also a social worker, I'm a peer worker, and I've got about 10 years experience working in the human services sector. I've worked primarily, but not exclusively, in the drug and alcohol sector across a range of different organisational contexts, such as like live-in residential, outreach, and detox. So I established Rainbow Affinity in March 2023 in response to the significant lack of culturally safe and affirming services for the LGBTIQ plus sister girl brother boy community across the southeast East Queensland region. My work with Rainbow Affinity spans counselling, advocacy, training, and research. So let's just have a bit of a look at what we're going to be covering today. So it's a 25-minute slot of the training or the presentation, and then we'll have 5 minutes at the end for Q&A. So we're going to be covering what is affirmative practice and why it matters, current data on AOD use within the LGBTIQ plus sister girl brother boy communities, common barriers to care, and practical strategies for more affirming culturally and safer support. So as Rita mentioned, we will have 5 minutes at the very end of the presentation for questions. So if something comes up during the preso, take a note, and there will be an opportunity towards the end to gain some clarity around some of the topics that we're going to dive into today. The LGBTIQ plus sister girl brother boy community is not a homogenous community. We are a community of sexuality diverse, gender diverse, and bodily diverse people. We are made up of a diversity of identities, cultures, experiences, and histories. When working alongside the LGBTIQ plus sister girl brother boy community, it is always vital to adopt a lens of intersectionality. A major barrier for LGBTIQ plus sister girl brother boy people seeking drug and alcohol support has been found to be the lack of an affirmative provider. Affirmative or affirming care has been recognised as best practice form of service for lesbian, gay, bisexual, transgender, queer and questioning people. The movement towards affirmative practice began in the late 1970s and was primarily developed as a best practice approach for working alongside LGBTQ clients. Affirmative practice is both active celebration and activist in its manifestation. It requires practitioners to actively affirm and honour identity while at the same time validating the oppression felt by the individual seeking services. Validation and empathy fundamentally result from an increased understanding of an individual's history, cultural context, and lived experiences. At its core, affirmative practice is about affirming someone's identity as well as validating the oppression that they experience or have experienced walking through the world. In adopting an affirming approach to practice, a person's identity is not up for debate, it's honoured. Practitioners use affirming language and mirror the terms people use for themselves. It's an understanding of the historical oppression our community has been subjected to over time, as well as an understanding of the current oppressions and form of discrimination that our community face. LGBTIQ plus sister girl brother boy people in Australia use alcohol and other drugs at higher rates and often begin using at younger ages compared to the general population. Importantly, not all use is harmful, and for LGBTIQ plus sister girl brother boy people, substance use is often shaped by cultural, social, and identity related factors, including coping with discrimination and participating in different subcultures. However, higher rates of impactful use that is use that results in negative consequences for that person, contribute to poorer health outcomes. Despite being recognised as a priority population in national and some state AOD strategies, LGBTIQ plus sister girl brother boy people continue to face numerous barriers to accessing culturally competent support across the country. Since 2010, the National Drug Household Survey has consistently shown high rates of substance use among gay, lesbian, or bisexual people relative to the heterosexual national population. These proportions have declined for smoking and alcohol use, which is consistent with the findings from the general population. Between 2022 and 2023, 47% of gay, lesbian, bisexual people had used an illicit drug in the previous 12 months, representing a substantial increase since 2019 when 40% had done so. After adjusting for differences in age, people who were lesbian, gay, or bisexual were still far more likely than others to smoke daily, consume alcohol in risky quantities, use illicit and pharmaceutical non-medically between 2022 and 2023. Private Lives 3 is Australia's largest national survey of the health and well-being of lesbian, gay, bisexual, transgender, intersex and queer people to date. The study found high levels of drug use among Private Lives 3 participants, consistent with the findings from the Australian Household Drug Survey. The report identified that over half of gay and queer identifying participants had used drugs for non-medical purposes in the past 6 months, followed by 46% of pansexual, 44.6% of bisexual, 34.9% of lesbian participants, and 13.9% of asexual participants. Cannabis use was reported more frequently by bisexual and pansexual and queer participants than gay, lesbian, and asexual participants. Cocaine and methamphetamine use were used by a greater proportion of gay and queer identifying participants. In Australia specifically, there is severely limited research regarding substance use amongst trans, non-binary and intersex people, largely due to the exclusion of adequate indicators in relevant data sets. Additionally, in Australia, there has been a significant lack of demographic data collected about trans, gender diverse and non-binary people seeking, accessing and engaging in alcohol and other drug services, given it historically hasn't been a compulsory requirement in the Alcohol and Other Drug Treatment Services National Minimum Data Set. For trans, non-binary service needs, treatment experiences, and treatment outcomes remain largely invisible. 2022 to 2023 was the first year that the National Drug Strategy Household Survey collected data on the experiences of trans people and alcohol and other drug use. The Private Lives 3 report highlighted that cisgender men reported the lowest levels of struggling to manage their AOD use or it negatively impacting their everyday life in the past 6 months, and trans women reported the highest levels of struggling to manage their alcohol and other drug use or it negatively impacting their everyday life in the past 6 months. Service use was relatively low for those who reported experiencing problems with their alcohol and other drug use. The most significant barrier to alcohol and other drug mental health treatment and alcohol and other drug and mental health treatment support for the LGBTIQ plus sister girl brother boy community is the provision of culturally safe and affirming health services. LGBTIQ people may not access AOD or mental health support because of fears resulting from past experiences of discrimination, stigma, and trauma at health services. Australian and international studies show that LGBTIQ plus sister girl brother boy people underutilise health services and delay seeking treatment due to actual or anticipated experiences of stigma and discrimination from service providers. It can also mean that LGBTIQ plus sister girl brother boy people don't fully disclose relevant information about themselves and their health or support needs. Some negative experiences in accessing services for LGBTIQ plus clients can include overt homophobia, biphobia, or transphobia, abuse or discrimination from staff or other clients, particularly in residential. Assumptions being made about staff, about gender, and about sexuality or bodies, problems with language, terminology, and misgendering and/or misnaming of clients, and lack of community-specific knowledge, including lack of cultural fluency around LGBTIQ plus sister girl brother boy substance use. LGBTIQ plus sister girl brother boy folk may also experience additional forms of discrimination such as racism, ableism, ageism, and sexism. This is just a snapshot of some of the experiences collected in a study by Thorn Harbour Health of negative survey users' experiences. Just a couple, just looking at that is, yeah, the assumption of heterosexuality, which I guess is a worldview that's heteronormative, assumption of cisgender identity, which is also a heteronormative worldview and language. Something that I hear uh, other people in the community talking about a lot when they're accessing services is the, I guess, framework or approach that organizations take is that it's a sort of we treat everybody the same kind of approach, which I guess doesn't really take into consideration different marginalized communities' experiences and different social determinants of health, which is impacting them. On the 22nd of August 2024, an inquiry into the health impacts of alcohol and other drugs took place, a health-focused review of alcohol and other drugs policy, treatment services, community programs, and workforce to determine whether current settings appropriately support the prevention, reduction, and recovery of alcohol and other drug-related harms on individuals, families, and communities. The committee heard evidence that mainstream alcohol and other drug services are frequently not set up for the LGBTQ population, which was reflected in residential rehabilitation programs often being segregated by gender, as this approach is said to make these programs unsafe for some transgender, diverse, and non-binary people in particular. In addition to this, the committee heard evidence that many services in the community are run by faith-based organisations, and while the work of these organisations is admirable, accessing such services can be particularly challenging for members of the LGBTIQ plus sister girl brother boy community for fear of discrimination. Services not known to be accessible and affirming are assumed by community to be inaccessible and culturally unsafe. In order to become accessible, organisations must make their position known and take steps to create affirming environments. Affirmative practice is essential at every level of service delivery, from the website to the person you may speak with over the phone, in the first instance, in the waiting room, the intake process, assessment, and so on. When affirmative communication is present, it is verbal through comfort with LGBTIQ plus sister girl brother boy language, written in intake forms, visual displays of pride flags or imagery, and is linked to feelings of safety, trust, and being welcome. From the client's perspective, their first experience of a service may be through online advertising, such as a website or via social media. There are many ways to signal cultural safety through platforms such as badging web pages with recognizable symbols such as the pride and trans flag, social media posts to acknowledge that LGBTIQ plus sister girl brother boy days of significance or promotion of tailored support programs offered for the community, inclusive online registration forms, using inclusion statements such as LGBTIQ plus sister girl brother boy people are always welcome in this service, linking with LGBTIQ plus sister girl brother boy community groups and other organizations. A client may first present in person or over the phone. They may be feeling nervous and looking for signs that the service is safe and welcoming. Therefore, it is recommended that all staff to receive training on LGBTIQ plus sister girl brother boy affirmative practice, including reception, so that they feel supported and able to meet the client's needs. When addressing new clients directly, it is advised to avoid using gendered terms. When speaking to colleagues about a new client whose gender is not yet known, avoid using gendered terms and adopt gender neutral pronouns such as they, them. LGBTIQ plus sister girl brother boy people may look for visual indicators of safety, inclusion, and affirmation, such as flags on front doors, promotional materials, or lanyards. Importantly, these symbolic indicators need to be supported by safe and inclusive and affirming practice. Another important aspect of affirmation that is vitally important to note is how you manage access to the toilet facilities. During the welcoming process or in response to someone asking to use the bathroom, staff shouldn't assume which bathroom someone prefers and instead inform them what all the options are. Most service environments should have the capacity to provide at least one gender neutral bathroom option that can have visible signage. This can be offered to all service users along with any gendered toilet options. Best practice is to always allow service users and your staff to self-identify which bathroom they prefer to use. When intake forms use inclusive language, it provides an opportunity for LGBTIQ+ to go by the boy people to record who they are and helps build accurate evidence for targeted health promotion. Assessment and intake processes can be of special concern for transgender, diverse, and non-binary people. Their identity documents may or may not match their gender and name. They may be concerned about confidentiality, being questioned insensitively, or even that they will be denied a service. These processes have two components, the physical paperwork and the intrapersonal engagement between the staff member and the client. Organisations may have an operational requirement regarding their paperwork, but this should not preclude the capacity to allow people to self-determine their name and gender, and should be recorded in a way that other staff can easily identify the client's chosen name and gender. The next few slides are actions that can be adopted at the individual level. Practitioners can work towards an affirming approach by demonstrating competence with language. The more you use it, the more confident you will be. Leading with your pronouns in introductions or wearing a pronoun badge. Use gender neutral language and non-discriminatory language with all clients and colleagues. Be curious but respectful. Don't expect clients to educate you. Seek out LGBTIQ+ Sister Girl Brother Boy resources for your clients, like handouts and local groups. Develop a referral list and referral process to LGBTIQ+ Sister Girl Brother Boy affirming practitioners, organisations, GPs, community groups, and events. Build relationships with local LGBTIQ+ Sister Girl Brother Boy community orgs. Don't make assumptions. Listen for the language that someone uses to describe themselves and/or their family, and mirror the language that they use. Avoiding using heteronormative language. And for those who are not familiar with this concept, to be heteronormative is to hold the assumption that all people are straight and cisgender unless stated otherwise. It's a worldview that considers that to be the default way of existing and that privileges over any other way of existing. Heteronormity sets the standard that only straight and cisgender identities are the norm. Respect privacy and only ask questions that are necessary. Ask yourself, is this question relevant? Is it necessary for their treatment? Or am I just curious? Adopt trauma-informed, identity-affirming and non-pathologizing approaches that validate both the harms and the functions of substance use for LGBTIQ+ Sister Girl Brother Boy clients. Offer flexible care that adapts to people's evolving needs beyond a one-size-fits-all or abstinence-only models to include harm reduction. Engage clients in reflective conversations about how substance use aligns or conflicts with their values, health, relationships, culture, and other daily functioning. Actively engage with how LGBTIQ+ Sister Girl Brother Boy community norms, spaces, and subcultures influence a client's substance use behaviours. How do community subcultures and community settings impact your client's substance use and substance use goals? Create a non-judgmental environment for clients to discuss their substance use motivations openly, including the roles of sexual pleasure, identity, and personal expression. So from an organisational perspective, moving towards an affirming service and LGBTIQ+ Sister Girl Brother Boy affirming work culture can include ensuring representation and leadership of diverse community members among your staff, leadership, and board. Demonstrate publicly that your organisation strives to be LGBTIQ+ Sister Girl Brother Boy inclusive and affirming through your website and your social media posts. Ensure forms, documentations, and processes are inclusive and affirming. build relationships with local LGBTIQ plus sister girl brother boy orgs, commit to undergoing regular LGBTIQ plus sister girl brother boy cultural competency training from lead services and strengthen cultural fluency around LGBTIQ plus sister girl brother boy substance use to enhance the relevance and responsiveness of service delivery. The inclusion of adequate gender indicators in relevant data sets provides staff with resources to build confidence and establish Girl Brother Boy Advisory Council to inform the organisation of LGBTIQ plus Sister Girl Brother Boy issues and encourage feedback from consumers about their experience with the service. So that brings me to the end of this presentation. If you would like any more information about potentially having some affirmative practice for your organisation, please reach out to the email address on the PowerPoint there, jack@rainbowaffinity.com. And yeah, that's pretty much it. So